August is National Breastfeeding Month, and the next week is the start of Black Breastfeeding Week.
According to the World Health Organization, exclusively breastfeeding for 6 months has many benefits for the infant and mother. And back in the studio with us to talk more about it is Dr. Stephanie Hack. Thank you so much for coming back.
Thanks for having me.
So can you talk about some of the evidence-based benefits to breastfeeding?
Sure. So everybody talks about wanting personalized nutrition. Well, that's what breast milk is. It's personalized nutrition with immune support. Breastfeeding has so many benefits for moms and babies. Specifically for babies, you have less risk of gastrointestinal infections, less risk of ear infections. For moms, you have less risk of certain cancers like breast and ovarian cancer, and then also certain chronic conditions like diabetes and high blood pressure.
And what are some of the misconceptions out there about breastfeeding?
Oh, there are so many. I think one of the first ones is breast size. A lot of times people think, oh, well, if you have little breasts, then you're not going to make as much milk as someone who has larger breasts. And that's not the case. So the amount of milk that you're able to produce is going to depend on the person. It has nothing to do with the breast size. I think that's one of the biggest ones. And, you know, people think, oh, breastfeeding is easy because it's free. Breastfeeding is not easy, although it's something that can become easy over time. I think that's another one too.
And some moms say they have difficulty having their child latch onto their breast. Can you talk about what they should do when that happens and how quickly a woman needs to act?
Sure. So when you think about breastfeeding, it's not just the mom that's learning how to feed, it's also the baby. The baby's never breastfed before. So you're going to need support for many of us, especially if it's your first time ever doing it. And getting the support of your OBGYN or your midwife, they can be helpful in the process, but then sometimes even they need a little help showing you. So having the assistance of a lactation consultant, especially a board certified lactation consultant, and they can really go through the process of helping you learn how to latch the baby on and get comfortable, and so many of the nuances that go on with breastfeeding.
But if that baby just still doesn't latch, then you have to move to formula.
Most of the time the baby's going to latch. So there are other things. They have nipple guards and things that they can use, to actually assist. But even still, not everybody can produce breast milk, as much breast milk as someone else. And so you still may need to use formula for any number of reasons, or because you just don't want to breastfeed.
Yeah, and actually it's interesting, when my wife was had our baby, she actually did breastfeeding, and there was definitely this special bond that was there between the mom and our son. So talk about that special bond between the mom and her baby.
Yeah, so when the nipple is stimulated, there's a hormone in the body called oxytocin. It's the bonding hormone, and that does a number of things as well. It also helps the uterus contract, which is important postpartum for helping the uterus go down to its normal size. But it also just helps with the mother forming the connection with the baby. It is a really special, unique experience.
Can you talk a little bit about what is Black Breastfeeding Week and why is it so important?
Oh, it's so important. So Black Breastfeeding Week is recognized August 25th to 31st, and it's really a unique opportunity to focus on the challenges that Black mothers, Black parents experience when it comes to breastfeeding. We recognize that, data from the CDC shows that Black infants are less likely to be breastfed than white infants. And so Black Breastfeeding Week gives us a chance to acknowledge the structural causes for that gap, and then also to celebrate breastfeeding in the Black community.
And if someone is unsure about breastfeeding, what should they do?
Oh, seek help. There are so many resources for someone with breastfeeding. Seek help from your OBGYN or your midwife, from your lactation consultant, and there are a number of websites. There's also a free hotline in the United States that people can call for help with breastfeeding.
When we talk about misconceptions, I've often heard that women don't want to breastfeed because they think that their breasts will become saggy. Can you talk about that? Is that even true or not?
Your breasts are going to change. Let's be honest.
Yeah.
Your whole body changes with pregnancy. So there are times where people have, breastfeeding makes your breasts fuller because your milk glands are filling with milk. But then that's going to change some of the structure and architecture of your breast postpartum. So your breast can be less full postpartum. That's a thing.
Well, thank you, Dr. Hack, for having this really important conversation.
Yes.
So for more information on women's health and Dr. Hack's podcast, visit ladyparts.com.